Okay, so now we're just going to go over administering insulin via the subcut route or subcutaneous route, and also mixing of two different types of insulins, because it can be a bit tricky. So again, always starting with washing our hands, and we're going to review our doctor's orders with our MAR, make sure they're correct for the correct patient and that it makes sense. So it's again for Chris McPherson, and we're going to do 5 units of insulin R, subcutaneous, TID with meals, and this is 5 units, so right dose. Insulin R is the right drug. Subcutaneous is the right route. 3 times daily is the time with meals. So the times are listed there as 08:30, 12:30, and 17:30. And we're also going to do or review the 10 units of NPH insulin, so longer acting insulin. So 10 units, right dose, NPH insulin, right drug, subcutaneously, right route, and daily with supper, so right time. And so we're just going to put our orders aside once we know that they're correct. And we're going to complete our first check by removing the insulin vials. Insulin is typically housed in the fridge on your unit. It may be patient specific, it may be sort of a stock medication. So you just want to know the form or the process that your unit uses. And again, these are typically multi-use vials. So that you would want them to have a label on them indicating when the date and time that they were opened on, so that you knew when to discard them. Again, it's typically about 30 days later. So we want to make sure that we have the correct vials that match our MAR and what we're needing to draw up. So we're needing 5 units of insulin R, Humulin R, or regular. So that is what we have here. We've confirmed that. It's going to be given subcutaneously, so you want to make sure that it can be given subcutaneously. It's going to be given 3 times a day with meals. Again, wanting to make sure that it's not expired or that the opening date best before hasn't passed. That kind of thing, that this insulin should actually be clear, which it is. There's no sediment in there or contaminant concerns. We're going to do the same with our insulin N or NPH. So we want 10 units of this one. It's Humulin N, and it does say that it's NPH, and it's going to be given subcutaneously with supper. So on this one, I don't see any of those concerns. Also, you will notice that NPH is sometimes referred to as the cloudy insulin, so it's proteins in there, and right now they're sort of collected at the bottom. So a good way to mix that up instead of shaking it vigorously, because that can create bubbles, is just to gently roll it sort of in your hands beforehand. So kind of helps to roll it, and then you see that it disperses evenly and it becomes the cloudy insulin. So the proteins are evenly dispersed. So we have our insulins ready, and we're going to prepare to draw them up. And maybe we'll pretend that the time is 17:30. We're going to do that because we're going to give both insulins. And you may think, oh, we have to poke this person twice, but in fact, we can actually mix these 2 types of insulins together. So we'll go over that process. Because it is sort of a careful process so that you don't contaminate either with the other insulin. So before we start, as we discussed in a previous video, we're going to use our insulin vanish point syringe. And this is the only syringe that we use when we're drawing up insulin. It's calibrated to the type of insulin that you will be giving subcutaneously on the units. And remember, we talked about that U100. That's basically the only type of insulin you'll see most likely is U100. Other types like U500 do exist, but they're really, really rare. So you do want to make sure, though, U100 and it's U100. So we know that they're calibrated to our Vanish Point U100 syringe, and it's our insulin syringe. And as far as we're going to give this via the subcutaneous route, so it's a 29 gauge, 1/2 inch, which is appropriate for our subcutaneous route as well. And it's got a pre-attached needle again, right? So we're not going to be using that blunt fill beforehand. So just something to note. So we're going to clean the tops of our vials. These have been opened before, as you can see, but often insulin will be that way because it's typically a multi-use vial that it comes in. So again, we're going to clean it really, really well for 30 seconds, swabbing really well on that top. In the interest of video timing, we'll just kind of speed that up, but again, swabbing for 30 seconds both vials and then letting them dry. So the trick is, or the thing is, that we're going to drop the clear before the cloudy, or the shorter acting before the long acting. So we're going to be injecting air into our cloudy first, not drawing up any insulin. So we're sort of setting up our vacuum system, and then we're going to inject the rest of the air into the regular, pull that out, and then go back into our long-acting or N insulin. So if that was confusing, it means you're following along. It is a little bit confusing. It's a process, but you'll get it. So we're going to do 5 units of insulin R, and we're going to do 10 units of NPH. So we know that that's a total of 15 units. So we're going to put our plunger of our insulin syringe at the 15 unit mark, so that we're kind of already set. We're going to remove our cap, our needle cap, and we're going to, like I said, inject our air into our NPH insulin. We're trying to do it right at the center there. And we're going to inject 10 mLs of air, right? Because that's what we want to take out of this one. So we're going to inject right up to that 5 unit mark. And now, without taking out any insulin, we're going to take it out, remove our needle from that vial. And now we're going to enter our Humulin R vial to inject the remainder of our air. And this is where we're going to pull out our first 5 units. And you'll want to make sure that you don't have any bubbles in there. And especially this one, you have some wiggle room because you haven't injected, you don't have 2 types of insulin in here, so you can kind of go in and out of this vial. Once you do have your NPH in there, I think it should be obvious, but I will say it explicitly that you can't go in and out of this vial. So it's kind of a one shot that you get to get that full 15 units. So we have our 5 units of R now, which is what we wanted, and we've set the pressure on here so that it should deliver us the additional 10 to get to 15 units, and we'll see if that happens. But again, you will not want to be doing that in and out motion because you will inadvertently put shorter acting insulin into your long acting vial. So we will insert our, you can see that these needles are a little bit flimsy because of how thin they are, and you're going to slowly draw back till you get to the 15 unit mark. And you're not going to want to go in or out at all, you're just going to want to pull that off. So we're at 15 units of insulin, and we went through the steps of drawing up the clear before the cloudy or the shorter acting before the long acting. And now we're going to recap our syringe, our needle here. And we're going to label this insulin syringe. And I've gone and pre-labeled it because we're going to do insulin R 5 units, so drug name insulin R, and NPH we're going to do 10 units, so for a total of 15 units in this one syringe, in this insulin syringe. Insulin is also a tuner's check, so you'd want to have somebody second check your insulin and your process here. So you'd want to show them both vials and explain to them how you drew it up, or in some cases they'll actually watch you do it, and just to verify that you have the correct amounts of the correct types of insulin. So we would now perform our second check with this. So again, with your MAR, with your containers, your medication containers, or in this case your vials, with your syringe and with your label. So this person's blood sugar, because that would be a key piece of information before giving this insulin. We want to know that they do in fact require it. They're not going to go hypoglycemic from receiving this. So where you'll see that information a little bit different in different facilities, but this is an example of a diabetic flow sheet. So this is where it shows you the date, the millimole per liter, so that's their blood sugar, blood glucose, if it was initialed, or who did it, sorry, initialed, done on unit. And then, so this person's blood sugar we're going to say is 10.2. And this is what we're going to give. This is where we would document that we gave 5 units of insulin R subcut and 10 units of insulin NPH. We gave it at 17:30, we're going to say, and then you would initial it after it was given, and then you'd want to write in the comment section the site that you gave it in. So they're getting this insulin or this injections frequently, so definitely want to rotate the sites. So then the process is the same as with the other subcutaneous injection video, so we won't necessarily go over the process, but the one thing that I will demonstrate is with this insulin vanish point needle, and we talked about it a bit earlier on, but you are going to inject the entire contents of the syringe, and to ensure that you've done that, you're going to activate the vanish point inside the person. So also important thing to note, when you do your skin grasp for subcutaneous, don't let go once the needle is in. We went over some ways to stabilize, but a really important thing is that you don't let go of that skin fold when the needle is in, because that by virtue of letting go, you've destabilized the grasp or the needle itself. So once you have that grasp, maintain that grasp until the needle is out or the vanish point has been activated. So we'll just go over those principles of injection. So say we can grasp about 1 inch of tissue, so we're going to go at a 45-degree angle again. So you could use, again, like I said, the ulnar aspect of your hand to stabilize, or you can grasp with your ring and thumb finger, and then stabilize with these 2 fingers. So whichever works best for you, you can do that. And you can practice all the different ways. So we'll go ahead and inject, stabilize here, right? And we're not letting go of that grasp. And then we're going to depress our plunger to inject the medication slowly. And now we're going to activate our vanish point. So you hear that click, and the needle is gone. It sucks it back in. And now we can let go of the skin fold and apply our cotton ball. But it's that click activates the vanish point and it's sucked back in. That's how you know that the person got the entire amount of the medication that you had drawn up, especially when we're talking about insulin, because a tiny amount of units, sometimes you'll even see people have ordered just 2 units of insulin, and when you look at that on here, it's just such a tiny amount. So by activating that vanish point, you've ensured you've given the entire dose that they require. And then again, after, you're going to want to put a cotton ball, not massage, not rub or anything, just kind of place the cotton ball if they're bleeding at all a little bit, and then you can remove it shortly after. And this activated vanish point would go into the sharps container as well. So that's pretty much the differences with insulin. One other thing I think worth saying is that insulin is in units, and we talked about the calibrated syringe for units. You will notice that heparin was also in units. Those are not directly compatible or transferable, so you would not use an insulin syringe to draw up heparin. Units are specific to the drug that has been ordered or is prescribed for the patient. So units for insulin, that's the only time you'll be using this unit syringe is for U100. And maybe it sounds repetitive, but it's sometimes confusing when you're kind of starting out. You're thinking units and units must be the same thing. It isn't. Insulin is very specific with that syringe. It's calibrated only to that type of insulin. So that's pretty much it for insulin injections.